Bismillahirrahmanirrahim. Assalamualaikum and a very good morning. Yang berbahagia, Profesor Datuk Dr. Zulkifli Idrus, Deputy Vice Chancellor Research and Innovation, Universiti Putra Malaysia. Yang berusaha, Associate Professor Insinyur Dr. Siti Anum Ahmad, Director, Malaysian Research Institute on Aging, MyAgeing, Universiti Putra Malaysia. Yang Mulia, Datuk Dr. Tengku Hamid, Head of Consortium, Universiti Putra Malaysia, cum Research Fellow, Malaysian Research Institute on Aging, MyAgeing, Universiti Putra Malaysia, representatives from various ministries, universities, departments, agencies, and non-governmental organizations, our invited speakers, distinguished guests, ladies and gentlemen. On behalf of the organizer, Malaysian Research Institute on Aging, MyAgeing, Universiti Putra Malaysia, together with Universiti Kebangsaan Malaysia and University Science Malaysia, we wish to extend our warm welcome or selamat datang to the webinar and project launch Consortium on Mobility and Transportation in an Aging Society. To begin this webinar, I would like to welcome Yang Berusaha Associate Professor Insinyur Dr. Siti Anum Ahmad, Director MyAgeing, Universiti Putra Malaysia, to deliver her opening speech.
Okay, thank you Dr. Hayati Kadir, Madam Chairperson for our event today. Yang dihormati Profesor Datuk Dr. Zulkifli Idrus, Deputy Vice Chancellor Research and Innovation, Universiti Putra Malaysia. Yang Mulia Profesor Datuk Tengku Datuk Tengku Aizan Hamid, Senior Research Fellow MyAgeing UPM, Chair of Malaysian Aging Research Network, MAN, and Head of Research Excellence Consortium on Mobility and Transportation in Aging Society, COMTAS. Distinguished speakers, honorable guests, media representatives, ladies and gentlemen, Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning. Alhamdulillah, all praise be to Allah, by whose grace and blessings we are given the opportunity to be here today at this meaningful event. Ladies and gentlemen, first of all, it is my great pleasure to welcome all of you to the webinar and project launch, Mobility and Transportation in an Aging Society, which brings together stakeholders from different areas of gerontology, geriatrics, and gerontechnology. Selamat datang to this live stream seminar. May I begin this speech by sharing a bit about Malaysian Research Institute on Aging, MyAgeing. Well, actually today, 1st April 2021 marks MyAgeing 19th anniversary. We were established on the 1st April 2002 and known as the Institute of Gerontology or IG, and it was the first gerontology institute in Malaysia. Then, in recognition of the Institute contribution and role in the field of gerontology in Malaysia, on 20th March 2015, IG was rebranded as the Malaysian Research Institute on Aging, or MyAgeing. This rebranding heralds a new chapter in the field of gerontology for the nation and the region. At present, the institute functions as the focal point for policy, research and practice on aging in the country. Since its establishment, the institute has completed almost 90 interdisciplinary research projects with a total grant value more than 15 million from local and international funding agencies. We have the institute also has published over 300 high impact journal articles. Not just in research, MyAgeing also has been actively participated and contributed in industry and community relations. It is my pleasure to take this opportunity to give my deepest appreciation and huge thanks to the founder and former director of My Aging, Yang Mulia Datuk Dr. Tengku Aizan Hamid. She's been the director from the first establishment on 1st April 2002 until 1st April 2020 for the leadership and hard work who has brought My Aging success by becoming excellent research institute. Until today, Yang Mulia Datuk is still continue contributing her untiring efforts, guidance and support as our senior research fellow at My Aging. Our program today is one of her achievements. She is the chair of Malaysian Aging Research Network, MAN, Pro-Tem Committee, and she also, with the team, has secured a grant, a research excellence consortium from Ministry of Higher Education, named Consortium on Mobility and Transportation in Aging Society, COMTAS. Ladies and gentlemen, COMTAS is one of the projects under the Malaysian Aging Research Network, MAN, which involve collaboration from multiple expertise, which are UPM, Universiti Putra Malaysia, UKM, Universiti Kebangsaan Malaysia, and also USM, University Science Malaysia. Coinciding with Malaysia is expected to be an aged country in 2020. Issues of mobility and transportation for older adults are very important. This consortium will focus on research accessing the situation and preparedness of the public transportation system in meeting the needs of older Malaysians, as well as to profile the patterns of mobility among the older people living in the community. Hopefully, this study would also review on related policies and legislation, assessment of barriers and enablers of aged mobility and transportation, as well as the development and identification of technology, economic and environment and indicators on the age friendliness of the national transportation system in Malaysia. Therefore, the webinar is held just a moment to discuss these issues by expertise at the local and international level. Meanwhile, we have for local session, we have speakers from UPM, USM, and also Ministry of Transport Malaysia. Meanwhile, for international session, will include speakers from Asian Aging Business Centre Japan, University College London, University of the West of England, and Swansea University. I hope all participants will gain new and beneficial knowledge from this webinar. Today's event will be complemented by the Malaysian Aging Research Network website launch and inaugurate the Research Excellence Consortium on Mobility and Transportation in an Aging Society, COMTAS, which to be accomplished by Yang Berbahagia Professor Datuk Dr. Zulkifli Idrus, Deputy Vice Chancellor, Research and Innovation, UPM shortly. Before I end my speech, on behalf of the organizers, I would like to take this opportunity to once again express my sincere appreciation to our Deputy Vice Chancellor Research and Innovation, Professor Datuk Zulkifli, for officiating the ceremony, webinar and project launch, Mobility and Transportation and an Aging Society. Congratulations to the program committee and to everyone who have worked hard to make this event a successful one. Last but not least, thank you to all the speakers and participants for attending. We sincerely hope that you will find this webinar informative and meaningful. I wish all of you have a productive and great discussion. Thank you very much. Wassalamualaikum. That's all, Dayati, back to you.
Thank you, Associate Professor Insinyur Dr. Anong, for the opening speech. Ladies and gentlemen, today, My Aging celebrates the 19th anniversary of its establishment. Let's watch a video on the achievement of My Aging in 19 years to celebrate this special event's anniversary.
Assalamualaikum and good day to everyone. Today is the 19th year anniversary of My Aging. Since its establishment on the 1st of April 2002, My Aging has undergone a remarkable revolution in our pursuit to achieve our vision to become the center of distinction with international repute on aging. With your continuous support in the past years, the Institute has developed into a reputable and credible research center on aging, recognized both at national and international levels. My sincere appreciation and gratitude to our partners, research colleagues, staff, and students in this development. As a founding director, I am very proud to witness the progress and various notable achievements of the Institute. I hope we continue to collaborate for the betterment of older persons community. Thank you.
Happy 19th anniversary, My Aging. One of My Aging's achievements during 19 years of its development was the establishment of the Malaysian Aging Research Network, or MAN. Through this network, a collaborative research project has been secured, namely Consortium on Mobility and Transportation in an Aging Society, or COMTAS. Without further ado, I would like to invite Datuk Dr. Tengku Aizan Hamid, Head of Consortium, University Putra Malaysia, to give the introduction to MAN and COMTAS. Please welcome Datuk.
Prof. Tengku, can you on your mic?
Thank you. Yeah, it should be on show. The slide should be on show. Okay, let me, okay, yes, thank you. Sorry about the delay just now. Okay, let me briefly tell you about the Malaysian Aging Research Network and the Consortium on Mobility and Transportation. Transportation in Malaysia. The rationale for us to develop MAN was because Malaysia are having a rapid demographic transition and epidemiologic transition. And because of this, we have very short time horizon to look at our aging nation status. And Malaysia is becoming old before becoming rich. Therefore, we need evidence to develop our policy making and also do monitoring and evaluation for this for the aging nation status. And the way we felt that as an institute and having a national status, we need to collaborate with other people so that with our effort to address the current and future needs of aging issues will be highlighted. And because of that, we felt that this MAN should have a home in Malaysia. So the rationale for collaboration is that we felt that we need this working together because it reduces a lot of duplication in research and because of the limited resources. So that was why we felt that the MAN should be developed. So next, please. Okay, and if you look at the objective of MAN, we look at the MAN as a platform for promoting information, exchange and sharing of local research expertise, scientific development in the field of aging, and to develop the capacity and role of local researchers to spur multidisciplinary collaborative efforts in Malaysia, and to increase the impact and results of research in terms of policy inputs and programs at national and local level. So because if you look at how we are right now, we need to collaborate with each other so that we can solve problems of aging, because aging problem comes from many different angles. Next, please. Okay, if you look at the journeys for MAN, we have a very short journey actually. When we first did a preparatory meeting as an institute, we had funding from international colleagues to develop these things. And then we had our first workshop with the support of Kementerian Wanita to get together researchers in Malaysia who works on aging to decide whether we need to develop MAN, the research network and things like that. So at the first meeting in the workshop, the participants agree that we need to establish the research network on aging, and further to that, we had several meetings as a secretariat. The institute working as a secretariat for MAN. We had several meetings with Kementerian Wanita because Kementerian Wanita has an interest in our journey, because we are providing feedbacks to them for their policy implementation. Because looking at Kementerian Wanita, they are the implementing agencies related to population aging. So they have an interest with us as the research entity in Malaysia to look at how they can support, and we support each other in terms of this journey. So we had this meeting, and next please. We established the first formal meeting on MAN, and the agreement that the conclusion that we established on that day was all of us agree to establish MAN. Okay, and several meetings has been going on, and we had another workshop for MAN in 2020, where we had also in line with the ARGNA project of the ASEAN, funded, organized by LPPKN. So we were the co-organizer for this, and we wanted to really look at how our research network can really play a role at the ASEAN level. So this was the meeting for that, and we all agree that we should formally look at how MAN can pursue this agenda. Next, please. And at that second workshop, we sort of elected several colleagues to be in the pro-tem committee to man MAN. And me was elected as the pro-tem chair, and Prof. Mopin, Prof. Susanna, Dr. Rajini, who now changed the representation to Dr. Nuraliza, Dr. Muhammad Khairul Anwar Rahimi, and Dr. Tepeli, and also Dr. Azrini from different entity, and also from the different background that we have. So it really shows that even in Malaysia, we have different areas of people working in different institutions, and are interested to be working on aging. So at the second workshop, we established a pro-tem committee to look at how we want to pursue MAN for further implementation in the future. Next, please. And we had our first secretariat meeting in 2020 to explore what we want to do and how do we want to structure it. At the moment, the committee felt that we still want to maintain our loose organization, but we still work together to get it to achieve our means. And at the meeting also, next please, the pro-tem committee decided to pick the MAN official logo, which has two aspects to it. First, it is the image. Second, it is the wording. And the image is inspired by Malaysia. So we took the word M, and for an A for aging. So we agree with this because it shows connection between the workers that represents the different fields of disciplines and also the different institutions that are working together for MAN. So if you look at the word, the red word MAN, it's interconnected very closely together. So it just shows the close collaboration of the researchers working in this area. And the color red represent the color of life. As we do research to understand the life of our subjects and also to improve the lives of our subject. Black, the color of experience, and gray is the color of intellect and compromise. So within the three colors that we pick in this logo represent the embodiment of our work for the people, to the people, and the linkages that we have working together on the issue of aging. So this is why we decided that the committee decided to choose to pick this logo. Next, please. And these are our planning horizon for the next 5 years. And we have achieved some of these activities already. Next, please. And we are also working on the research information, trying to share open data, and we will be working on establishing working groups for MAN. And at the moment, the team are working hard and to develop the membership to MAN. Next, please. I think this is the most important achievement that we have so far in our short life. We developed a proposal and submitted to Frontiers in Public Health for a special issue on aging research and activities in Malaysia. And the guest editors are the 6 of us. And then it was open on the 1st of March. And next please. And successfully, we have published 15 articles on that, and this is no small feat, because frontier science is very, very rigorous in terms of their processing of publications. So congratulations to those to colleagues who were able to publish in this initial publication that we work with Frontiers, and I think many more will be coming. Next one, because of the collaboration that we have with the history of collaboration in research and activities, we decided when the Ministry of Higher Education opened a funding bid for research excellence in consortium, funded, we as a team from USM, from UKM, sat together to develop this proposal, and alhamdulillah, we were successful in bidding for this grant. And the grant is called the Consortium on Mobility and Transportation in an Aging Society, and we call it COMTAS, because this is the consortium that has really focused on mobility and transportation. And we will be working together for several years, actually, to look at how we want to make our transportation age-friendly, and how we can move along with this so that we can achieve by 2030 the aged nation status of Malaysia, and we are prepared, at least in the element of transportation and mobility, with evidence to show to our stakeholders of the need to change in the way we look at mobility and transportation for older persons. So this is where we want to do it today, and today is also the official launch of our logo. And also in the process of MAN, okay, we as the Secretariat, looking at MAN, we have developed a website for us to be working to be putting our information and be a member of MAN, because as a member of MAN, the benefit is we collaborate with each other and we have a better reach to people and to our stakeholders And also it is easier for us to translate our research into policy because we have looked at the different angles of aging and we come up with a solid solution to this. So next, please. Thank you very much.
Thank you, Dr. Tengku Aizan. With great pleasure, I would like to welcome Professor Dr. Zulkifli Idrus, Deputy Vice Chancellor, Research and Innovation, University Putra Malaysia, to deliver his speech and officiate this webinar. It will be followed by launching the MAN website and Consortium on Mobility and Transportation in an Aging Society project, that is COMTAS. Welcome, Professor Dr. Zul.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning, afternoon and evening. Associate Professor Insinyur Dr. Siti Anom Ahmad, Director, Malaysian Research Institute on Aging, Universiti Putra Malaysia, Datuk Dr. Tengku Aizan Hamid, Research Fellow, Malaysian Research Institute on Aging, Universiti Putra Malaysia, come Chair of Pro Tem Committee, Malaysian Aging Research Network, and Head of Consortium on Mobility and Transportation in an Aging Society, distinguished speakers from Malaysia, United Kingdom and Japan, honorable guests and representatives from various ministries, universities, departments, agencies, and non-governmental organizations, principal officers of Universiti Putra Malaysia, media representatives, ladies and gentlemen. Alhamdulillah, let us extend our sincere gratitude to Allah Subhanahu Wa Taala for allowing us to be here today for the webinar and project launch, Consortium on Mobility and Transportation in an Aging Society, or COMTAS. I would like to greet all of you, especially overseas speakers from United Kingdom and Japan, selamat datang or welcome. I would like to applaud the organizers for bringing together the stakeholders from various areas of gerontology and geriatrics to today's webinar. I'm told that this event is a collaborative effort involving several institutions, namely Universiti Putra Malaysia, Universiti Kebangsaan Malaysia, and University Science Malaysia. On behalf of Universiti Putra Malaysia, I'm indeed delighted that all of you have graciously accepted our invitation. I would also like to express my appreciation and congratulate the company on its 90th anniversary today. I believe many successes have been achieved by MyAging, starting with the name Institute of Gerontology, which was established on 1st April 2002, until now with the upgraded name Malaysian Research Institute on Aging in 2015. As shown in the video presentation just now, on behalf of UPM, I'm very proud of MyAging for the great work and achievements in both nationally and internationally collaborative scientific activities in the field of gerontology. In order to expand the research area, connect researchers and facilitate sharing of expertise and resources, MyAging had initiated the Malaysian Aging Research Network, or MANT, in 2017. MANT builds a structured research network on aging at the national level. The network aims to provide a research platform on aging to local expertise to foster scientific development in gerontology, develop international research capacity in aging, and to increase the impact and results of research on aging in terms of policy inputs and programs. Ladies and gentlemen, like other countries of the world, Malaysia is experiencing population aging too. By 2030, Malaysia is projected as an aged nation when 50% of its population consists of older persons. To ready for the aged nation, mobility and transportation for older people should be given attention. A good transportation system encourages mobility and social engagement in older people, thereby increasing their social cohesiveness. Therefore, the Consortium on Mobility and Transportation in an Aging Society, or COMTAS, is relevant to study the issues and challenges pertaining to mobility and public transportation use among the older population. COMTAS is a collaboration project between UPM, UKM and USM under the Malaysian Aging Research Network, or MANT. Congratulations to COMTAS for being the only Research Excellence Consortium in UPM that has successfully obtained 500,000 ringgit Malaysia to carry out research on age-friendly mobility and transportation in Malaysia. Ladies and gentlemen, on behalf of Universiti Putra Malaysia and the organisers, I wish you all an engaging and informative discourse. It is hoped that this event will provide a platform for closer networking and collaboration in our future professional relationships. Before I conclude, I would like to thank all the institutions and everybody involved in making this event possible, especially Associate Professor Dr. Zumila Zainaluddin, the chairperson of the organizing committee, and a supportive team at MyAgeing. A note of congratulations is also for the leadership and the untiring efforts by Yang Mulia Datuk Dr. Tengku Aizan Hamid as the Chair of Pro Tem Committee, Malaysian Aging Research Network, as well as the Head of Consortium on Mobility and Transportation in an Aging Society, or COMTAS. This collaborative effort, I must say, is very commendable and should be continued in the future. Shabas, I'm looking forward to hearing about the success of this initiative. Last but not least, to all the participants, thank you for your commitment to this webinar, and we hope that you will find it informative and worthwhile. I wish you all a productive discussion and a successful endeavor. With Bismillahirrahmanirrahim, I hereby declare the webinar on mobility and transportation in an aging society officially open. Also, I would like to launch the Malaysian Aging Research Network website and the Research Excellence Consortium on Mobility and Transportation in an Aging Society. Thank you. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
COMTAS' mission is to engage diverse stakeholders in conversation about solutions to navigate inclusive, safe mobility and transportations for all ages, and to develop and deploy cutting-edge science to understand aging, mobility and transportation needs. Its vision is a referral center for age-friendly mobility and transportations in Malaysia and Southeast Asian region. The goal is to develop indicators of age-friendly mobility and transportation system for Malaysia. COMTAS' core values: collaboration with diverse participants, science applied and theoretical, comprehensive and holistic, transparency and accessibility, progress and solution. The objectives of the COMTAS are to explore the multimodal patterns of mobility and transportation usage in old age, especially among the elderly living in the community, to understand the characteristic of transport by older travelers to healthcare facilities and grocery retail outlets, to explore the issues and challenges which are the cost, operations and efficiency of public transit users and service providers for older travelers, and to develop indicators of age-friendly mobility transportation system for Malaysia. COMTAS is a consortium established by Malaysian Research Institute on Aging, MyAgeing UPM, Centre for Healthy Aging and Wellness, HCare UKM, and USM Riken Centre for Aging, Eureka's USM. COMTAS is about collaboration, multidisciplinary, aging, mobility, transportation, smart technology, health and well-being to achieve sustainable development goals.
Thank you, Professor Dr. Zulkifli Idrus, for officiating COMTAS and the MAN website. Ladies and gentlemen, we will begin our national webinar shortly. The session will be chaired by Dr. Abdul Rais Abdul Latif from University Science Malaysia. Please welcome Dr. Abdul Rais.
Thank you, Madam Chairperson. Assalamualaikum and salam sejahtera. Welcome everyone. Thank you for joining us for today's webinar. I'm Abdul Rais Abdul Latif from University Science Malaysia and a satellite head of Consortium on Mobility and Transportation in an Aging Society, COMTAS. I would now like to warm welcome our speakers for today. We have Associate Professor Dr. Saidatul Akmal Muhammad from University Science Malaysia, Dr. Irwansyah Muhammad Yusof from University Putra Malaysia, Yang Mulia Insinyur Tengku Kahar Muzaffar bin Tengku Muhammad Yusof Anwar from Ministry of Transport Malaysia. We are so glad you could be here today to share your insights on mobility and transportation in an aging society. Today, we have 3 presentations from our invited speakers. Just a little housekeeping before we get started. Each presentation will take 15 minutes, and if you have any questions during the presentation, please type them into the question box in your Zoom or Facebook Live comments control panel. I'll bring up during the question and answer session at the end of all presentations. Now, without further ado, we will turn the time over to our first presentation. Dr. Saidatul Akmal Muhammad is an associate professor at School of Social Sciences, USM. Currently, she serves as a director of Center for Global Sustainability Studies, USM. She is also a project head for USM RIKAN International Center for Aging Science, EURICAS. Her contribution in the field of research is undeniably outstanding based on her publication record, which contributes to the growth of body of knowledge in the field of elderly, poverty, welfare economics, tourism economics, and development economics. She received various recognitions from professional involvement and contributions from national and international agencies such as ASAE, American Economic Association, OECD Korea Policy Center, and MDI. And by that, I invite Associate Professor Dr. Saidatul Akmal Muhammad to present her presentation. Thank you.
Thank you so much, Dr. Abdul Rais. I think all of you can see my slide. Thank you again, Dr. Rais, for the generous introduction. And thank you so much to My Aging and the Consortium on Mobility and Transportation in an Aging Society for inviting me to share my research findings this particular morning. Before that, congratulations to the organizing committee for organizing this particular session, as well as the launching of the consortium. So what I plan to do this particular morning is to share some of the findings that my team and I have somehow gathered from our studies on the mobility of older person that we have done in Georgetown as well as Malacca. So Dr. Rais is also part of this particular research. So this is just going to be a very simple presentation that I share what we have found with regard to the older person's mobility. Just to catch everyone's attention that, you know, this is just a case study of 2 small cities with a small sample. So we have to be very cautious in generalizing the particular findings to a larger setting. So let me start. So when we do this particular research, we have one particular questions, or basically, and a few questions that follow to basically answer what we actually wanted to know from this particular research. The first question that we wanted to answer when we do this research is, do older persons remain active? And if the answer is yes, we want to further know where do they go? Okay, so basically when you say, do older persons remain active, to put in the context of traveling and mobility, we ask them, do they travel? So if the answer is yes, we want to know where do they go? How frequent is their traveling? And what is or the purposes of their traveling? And basically what motivates their reasons to basically travel. If, for example, the answer to the older persons, the first question is no, we also want to know why don't they travel? Is it because the environment is not accommodating enough that do not encourage their traveling? Or what are the other factors that contribute to them not traveling? So what we do in this particular research is we ask the older persons or the elderly to record their travel information using a travel diary. But in the past, when people do and adopt research using a travel diary, it's really a diary, you know, explaining in detail the traveling exercise or the traveling pattern of a particular individual. But because we are dealing with older persons, we want to make sure that, you know, we are not burdening them so much with information recording. So in a way, it is a travel diary which is a bit more structured. So what we asked is, we asked them to fill in the travel diary, a semi-structured travel diary, And we asked them to record their travel information for the past 1 week. So we came to their residence and then explained to them what they need to do and asked them to record their diary for that particular 1 week. So after 1 week, we will come back and take the diary from all of them. So we asked them to record their diary for a duration of 1 week. So where do we go? So basically, as what the title have mentioned, so we went to Georgetown, Penang, as well as Malacca. So these are the two heritage cities, and we thought that, you know, it would be nice to investigate how older people adapt to the heritage cities and how would the environment within the city promote or basically hinder their traveling pattern. So our survey, we interviewed elderly person who are 60 years old and above, and we put a condition that they have to be mobile. So because we want to look at their travel pattern, so these elderlies must be mobile. So what we managed to do was interviewing 300 older persons in Georgetown and 155 in Malacca. So the composition were 51% of female and 49% of male. So this is an approximate composition of the national data with regard to female and male or gender composition of the older persons population. So our study was done 2 years ago in July. So we kicked off our survey in Malacca in July 2018. And then we kicked off our survey in Georgetown in October 2018. And of course, because these older persons are considered as a vulnerable group, so we had to request for ethical clearance, and we managed to get it from the USM Research Ethics Committee. So then it goes to our first question. Do elderly or do older persons travel? So we basically checked the diary, and we realized that 70% of them actually travel for the past 1 week. So we can make a rough conclusion here that, you know, elderly or older persons in Georgetown and Malacca are actively participating in active aging, or basically actively traveling and engaging in any sorts of social and economic activities. So when we further want to understand the socio-demographic patterns of all these elderly, so we basically check. Although our survey had more female compared to male, but the data indicated that more male elderly travel as compared to the female elderly. And when we further segregate it into the different cities, we realized that those in Georgetown are traveling more as opposed to those in Malacca. And when we further segregate into groups of elderly, so what we did was we separated the elderly into 3 groups. The young old are those elderly aged 60 to 64, middle old. I would appreciate if nobody can scribble on the screen. The middle old is 65 to 75, and the old is more than 75 years old. So we can see that of the different categories of elderly, most of them who travel are the one aged 65 to 75 years old. So you can see from this graph that 29% of the elderly have not traveled for the past 1 week. So we also want to understand, if you don't travel, why don't you travel? So we asked them to answer an almost open-ended question. So you can see the biggest reason they indicated for not traveling was nowhere to go. So this is a bit alarming when we know that, you know, they actually wanted to travel, but they don't know where to go. So these provide a very significant policy implication. If we were to promote active aging, then we have to make sure that there are facilities and infrastructures and places where elderly can go or activities that they can participate. And then another one is associated with health. And this is understood because, if the elderly is not well, they are unable to travel. And our data indicate that quite a number of the older persons are still staying in or living in with their children. So they said that the children have no time to take them to go for outing or to go anywhere else. And the other reasons, like a few say that they didn't feel like traveling. Some says car breakdown, and few associate for other reasons that include, they travel a week before, but it's just that this week they didn't travel, or some other reasons that are significant to their decision of not involved in traveling. So the next question that we ask is, if you travel, how frequent do you travel? So this is where I would like to engage all of you to be involved in just a quick survey. If you can just go to Mentimeter, if you can go to Mentimeter, www.menti.com, and use this code 90173939, and let's just see how you understand, how frequent do you think older persons travel? So because what we ask is, do they travel 1 trip per week? Or is it 2 trips per week? Or is it 4 trips per week? So we ask them all these questions. And if you can just, let me see whether this one is working or not. So you just enter the code 90173939, and you just submit, and you have the questions, and you can just choose which one do you think that you feel that they are engaging in traveling. So you can see that when we first started this survey, we also do not know, whether older persons are actively engaging in traveling or not. And our first perception was that they either don't travel because of the living patterns, because they are staying with their children, and because they are not actively engaged in their current life, or they are somehow involved in lots of traveling, but maybe not as frequent as what we thought that they would be involved. So, thank you so much for sharing your ideas. So this is what we also thought, basically this was also our hypothesis when we first did our study. But when we further analyzed, we realized that they actually traveled, and the minimum travel is actually 1 trip per week. And the maximum travel trip is basically 5 trips per week. And on average, the elderly involved in at least 1.6 trips per week. So basically, when we segregate our data into the different cities of Georgetown and Malacca, we realized that the people or the older persons in Malacca travel less trips as opposed to the older persons in Georgetown. And the older persons in Georgetown travel more than average of the 2 older cities. But although they travel, and although they made at least 1 trip per week, a majority of them only travel within 1 to 5 kilometers per week. So they don't engage in long trips, and basically they are only involved in shorter trips to accommodate their needs as well as to accommodate their purpose of traveling. So what we do is then we ask, how do you travel? Okay, so we separate it into different categories of traveling. So you can see for Georgetown, we put a picture of people walking, and for Malacca, we put the photo of a car. So you can see there is quite a vast difference between the mode of transportation in Malacca as well as in Georgetown. So in Malacca, you can see that they travel as a passenger, given that they are living with their children, and this is a majority of the older persons of 49%. But they are also active in participating as well as in engaging in their own traveling pattern, in which 27% of them actually drive to whatever destination they wanted. However, in Georgetown, although you can see almost a similar pattern, almost the same bubble between being a driver as well as being a passenger, but quite a significant is also involved in walking. 21% of elderly in Georgetown are involved in walking, while only 15% of elderly in Malacca involved in walking. You can see public transportation is one of the smallest bubble either in Malacca as well as in Georgetown. So we wonder, why such a pattern with regard to mode of transportation. So if you look here in Georgetown, quite a significant percentage actually owns a private vehicles, and quite a big percentage as well of 32% do not own private vehicles. So this could explain why quite a significant 21% are involved in walking. But when you go to Malacca, you can see almost same pattern for owning private vehicle, one of the largest. But you can see that they are also elderly or basically older persons who are mostly involved in sharing vehicles with their family members. So basically, 39% of them are basically having a family-owned private vehicle. So you can notice that a lot of them are actually a passenger for traveling. So we can make a conclusion from this particular data saying that private vehicle is still a preferred choice. This raised a lot of significant issues with regard to promoting active aging, because our previous data indicates that elderly travel short distance between 1 to 5 kilometers. And if this is pertinent to the other states and other groups of older persons, we might want to rethink about the use of private vehicle and emphasize on public transportation. But our data in the two cities indicate that public transportation is one of the least options of mode of transportation for the older persons in both heritage cities, Georgetown as well as Malacca. And you can see also in Georgetown, more older persons are involved in walking as opposed to older persons in Malacca. So these data signify a very important policy direction on how are we going to allow the older person's engagement on traveling. So then I would like to take all of you again to another engagement with Mentimeter. So if you can just go to Mentimeter, and this time you have to use a different code. So basically what we want to know, the next question that we ask our elderly is, if you travel, what do you do? Because we also want to know if they are involved in travel, what do they do when they go out? Do they go out for the purpose of doing their grocery shopping or do their own shopping activities? Or do they go and do some family engagement? Or most of them would go for hospital appointments. So what do they do? So when we first proposed our hypothesis. We said that perhaps the elderly are more involved in engaging in hospital appointment rather than any other things, you know. And then we also thought that perhaps also family engagement would be something that they are involved in. And the reason why we want to ask on why this, what do they do, is because we want to know what type of activities are they mostly involved in, you know. And we also include work in our choices because we also want to know whether elderly are still actively involved in work activities, or, you know, are they active because of other purposes, or are they active because of something that they are engaged in. Thank you so much for your participation. So when we further investigate, we ask their purpose of trips for all the trips that they are engaged in up to the 5th trip. And we realize for the first trip that most of the older persons are engaged in, you can see that medical purpose is one of the least reason being quoted as the reason that they travel. There are many reasons here. Perhaps also that they were not involved in many hospital appointments. And also because these older persons that we interviewed are basically those who are mobile and therefore are active and may not require that frequent trips to hospitals. Most trips quoted are basically family engagement as well as shopping activities. So basically elderlies are still emphasizing family activities as well as shopping activities. And the similar trend is observed for the 2nd trip as well as the 3rd trips. But of course, when you go all the way to the 5th trip, you realize that the purpose they travel frequently are basically for recreation as well as family engagement. So these again provide a very important policy implication on the kind of activities that we would like to promote to engage or basically to encourage active aging among the older persons in the country, although the study is for the 2 different cities. Here we do not include the segregation of data between Penang as well as Malacca because the 2 cities exhibit almost similar trip analysis traveling with regard to purpose of travel. Nevertheless, the elderly in Malacca are more frequent traveling for the purpose of medical or hospital appointments, but this is basically very pertinent among the old persons, basically the group of 75 years and above. And this is understood because these are the group that are mostly fragile and mostly require the attention of medical requirements. So it's really interesting to see that you know, the family values are still there, and we know that, you know, the children are still actively participating in ensuring that their parents are still active in their traveling purposes, taking them either for any family activities or ensuring that they are involved in some recreational activities during their leisure time. And then our second question goes to the title of the presentation. What are the factors that basically motivate the elderly traveling? So what we did here is we estimated a Poisson regression estimation, taking number of trips as our dependent variables, And then we include other variables as our independent. And these are the sum of the variables that we have included in our Poisson regression estimation. And we have tested it, and the model is robust and is able to provide the answers to the questions on what motivates elderly from on traveling. So we include city because we wanted to know whether there is a vast difference between the two cities, Georgetown as well as Malacca. We also include education level. We wanted to know if education has any influential factors in deciding the traveling pattern of the elderly at a later age. Health condition, because we did see one of the reasons why the older persons do not travel is because of health condition. And also in trip 1, we see that at least 15% of the older persons travel for medical purposes. We also included one extra variable here. We wanted to know if the elderly are active, not only in traveling, but also in making sure that they remain healthy. So we wanted to know if they are involved in some form of health promotion behavior. If they are involved in health promotion behavior, if they really take care of their health, would these actually influence their traveling pattern? And for this particular question, for this particular variable, we actually put a lot of criteria. And here I'm just going to share with you one of the significant finding that is involved in minor exercises every week.
Dr. Herato, sorry to interrupt. We have another 2 minutes to go. Thank you.
Thank you, Dr. Rais. And then we also asked about the transport ownership, whether these influence their trip activities. So we see that as what we have seen in our descriptive analysis, more trips in Georgetown, more trips for healthier older persons, more trips for older persons with tertiary education, more trips for older person engaging in frequent exercises, as well as more trips among those who own private vehicle. So these could provide some early preparation on how and what to do to encourage traveling among the older persons. And of course, there is a similar trends of traveling patterns among older persons in the 2 cities that we investigated. So finally, in conclusion, when we go back to our questions, do older persons remain active? Do they travel? The answer is yes, older persons travel. How frequent is the travel? Older person travel at least once per week of between 1 to 5 kilometers. What are the purposes of their traveling? There are many purposes, but basically recreational and family engagement are the 2 main purposes of traveling. What motivates the elderly to travel? So basically a lot of factors are contributing to the traveling. Among them is ownership of transportation, health condition, health promotion behavior, education, as well as where they are. And from these particular findings, we can also come up with a baseline information on what are needed to promote traveling among the older persons. The first one is basically all persons friendly infrastructure to encourage traveling. And the 2 things that we see here that is lacking in both cities are walking pathway as well as public transportation. And another one is friendly recreational activities. And of course, we need to promote a healthier lifestyle among older persons as well as younger cohort. So that wraps up my quick 15 minutes presentation of the research that we have done with regard to elderly or older persons mobility in Georgetown as well as in Malacca. Thank you so much, Dr. Rais.
Thank you very much, Associate Professor Dr. Saidatul Akmal Muhammad. Before we move to our second presentation, let me briefly introduce our second presenter. Dr. Irwan Shah Muhammad Yusof is a senior lecturer in the Department of Resource Management and Consumer Studies, Faculty of Human Ecology, University Putra Malaysia. Ergonomics is his main focus area with an emphasis in aspects of consumer safety and healthy issues in improving the work environment's quality and ensuring the well-being of life. Product design based on consumer sustainability is also his concern. His latest studies focuses more on the issues of elderly drivers to minimize health problems-oriented musculoskeletal disorders, MSDs. He is an associate researcher at the Malaysian Institute of Aging, MyAging, and the Sustainable Consumption Research Center of Excellence, CORE, as well as a life member of a Malaysian Association for Consumer and Family Economics. Without further ado, I'd like to invite Dr. Irwan Shah Muhammad Yusof to present his presentation. Thank you.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. Thank you very much to our moderator, Dr. Abdul Rais Abdul Latif, to invite me to join the webinar Mobility and Transportations and Aging Society, COMTAS, on 1st April 2021. Today, I would like to share my research. It was done past 2 years ago about experience occupational elderly taxi driver in Malaysia. Before I start, I'd like to share you content of my slides today. I would like to share about the data on population elderly, on preliminary about the elderly in Malaysia. Secondly, about the backgrounds, distribution of taxi driver, why they are being taxi driver. Fourth, data of background of the other taxi driver, data disease on the lifestyle, occupational of the taxi driver, and trends, and six driving effects, and last not least is a conclusion and recommendations. Okay. Before I start, okay, I'm asking to everyone, okay, everyone, are you feel that you are elderly or elderly enough? So there is this question. Why I'm raised, because there is a definition a bit have revised from World Health Organizations that will define that who those 18 to 89 years was their falls under elderly or senior citizens. So however, this definition, you might be surprised, but they were revised, and that 66 to 79 is middle age. That most of us still of middle age or young or people. That is a definition by the WHO organizations that were revised as 2018. However, we will use of definition of elderly or adult people based in Malaysia definition. We will false 60 years old and above, defined as older people. Okay. So this is a preliminary about Malaysian population to 2019. Okay. So this data was sourced from the Department of the Statistics of Malaysians, that will show this current on 2019 is Malaysian population is now 29.4 billions. But I believe now, and we are in 2020, our population is now approximately 34.0 population. However, the percentage of the elderly people will increase. In 2018 is 6.5%. Now will increase to 6.7. So then we can see that 60 years old and above, there was on 2019, the most of the increase of the population of Delhi will increase on 0.3% compared to the compared to year of 2018. Okay, there is about a little bit of Malaysian situation elderly or older people in Malaysia. Okay, so there is our, as I mentioned before, there we use on the Vienna definition, and where at the World Assembly on Aging in 1982 that everyone aged at 60 years and above fall under category older peoples. Okay, as we know, older people more vulnerable to injury compared to other generation, compare adults, young citizens, kids, teenagers, because of more numerous of factors. Because these categories of older people is very fragile. Okay, the structural body of the people too very easy to call with exposed to other injuries or disease. Okay. Okay. This is a bit about the nation in 2020. We approximately that, as I mentioned, in 2020 we have a 34.3 million. So whereby we estimate about the elderly people, older people, age 65 and above. In Malaysia, we have 20.4 million, the total population. So that is a very surprise that show that Malaysia will have the good lifestyle of elderly. So this is about about Malaysia. Okay. So then we see also a trend of the Malaysian pattern population. So we can see about 2015, the trend is the pattern of the growth of the Malaysian population. It showed that, okay, they show that the pattern more like the angkor, okay, designs the population. However, we are approximately the Malaysian population is the primary was changed. They will change, and in 2035, the age will be growth. Okay, will grow. We saw the significantly difference will increase, especially will start in years 15 years old and above. They will start a grow. Okay, so that will show that the study of the elderly people in Malaysia, we need give more focus about how the difference and the character of the elderly people in Malaysia. We need to study more about the elderly peoples. Okay, so they study about why the problem of the elderly people in Malaysia when age was increased, that definitely the factors of the elderly peoples will decrease and change in terms of the behavior, physiology, attitudes, character, emotion, and focus. So this photo I took during my research past 2 years ago, which showed this is photo that the elderly taxi driver. These persons, that age, that time 82 years old, that he's still driving as taxi driver. We can imagine the we call uncle, from this still driving taxi driver. Why? The question is why that current age at 30 years old, 20 years old, still as being taxi driver. There is a question mark from I bring to all the force to everyone on the this webinar. This question mark. Okay, there's a lot of things we need we are asking. Okay, okay. Another question is the day of during the driving, most of the people they have a bad driving. This is not in terms of the other people. Some are most of the driver same of we as young driver or teenagers when you're driving, we have tend to be bad driving. That will cause of the physical fatigues and body injuries, other negative impact. So that will drive to significant to other factor negative impacts. So they will give many negative factors. Okay, the comfortable driving posture will make or avoid or minimize a muscular disorder and cognitive disorder. So what happened if we adapt the bad driving? So because especially among other people. So however, especially our moderator. So I believe when you're driving from USM to UPM, so other long distance, we are intend to have this kind of work posture, awkward driving. So that we feel the fatigue, we feel sleepy. We feel a lot of the negative impacts. Okay, this is not about the adult. That is also reflect to us also. Okay, so the most injuries were facing by us, and also especially the older people is at the upper torso body, lower back, and back pain. So I'm also always feeling this and also facing about the back pain. This is one factor of the character of us, how we apply on driving. Okay, so there is reason why the other people choose be a job taxi driver. So there, during my study, we predict another 5 years this job will have high demands. The reason is about, first is the less energy compared to other fields. They will maybe these other people, they will not will choose to be taxi driver because they have less energy. Okay, they will not be construction job. Okay, so construction fields. And then especially in Malaysia, and the government will not have a specific regulation expertise to be a taxi driver. Our government will focus about the thing we call us about the transportation itself. It's not the people itself. There's just enough. Then we need to go to the we call the medicals reports by doctors. Then screening with that, then they can be a taxi driver. Another factor is about the low cost. So you want to be a taxi driver, you want to be a Grab or e-hailing service driver, it's so easy. So they don't need to some financial, big funds to invest, to set up compared to other fields. So such as you want to start up on about the restaurants, to be another business. So and require of the highest of the funds compared to the taxi. So they just require about taxi, transport. Okay. Then another one is the reason is a light job, easy to handle, because then most of them already have experience to be taxi to be driver before. Okay, so they are familiar with the road, familiar with the location. So they feel that the taxi driver, being taxi driver, easy to them and easy to gain on in terms of the finance. Okay. Okay, this is some the view about taxi driver in Malaysia what I took during my study. So there are some on the East Coast and then the South, Centrals, and the West also. So they show that the significance of numbers of this taxi driver in Malaysia. Okay, there. Macam cuba. Just to show the video. I don't want to share the video. The video everyone. So this and also there we also have a female taxi driver. Okay, and a male. The majority of them are male, and so there also the present of male. I am also have a chance.
Sorry to interrupt, Dr. Irwan. You still have 2 minutes more to go. Thank you.
Sure, thank you, Dr. Video. Okay, this taxi distribution in Malaysia. Why I'm choose the taxi driver in Malaysia? Because the distribution of Malaysia, they show that we have the budget on the, and also high the taxi category very high in Malaysia. Okay, the background of the study show that the rural and urban area, the four regional in Peninsular Malaysia, that were involved 443 samples involved, location and the bus station, shopping mall, train station, public and area and other area spots. Okay. So the purpose of sampling method was choose in the study and then self-driving, no handicap, driving experience at least 1 year to be taxi driver, and all the taxi driver must be registered with Line Public Transport Commissioners, and they have no neurological problem involved this study. Okay, the result will show that they have 50 more than majority of them. The other taxi driver are budgets, and 66.1% are smoking. Now I'm very surprised that it showed that more of them smoking, and also more than 50% of them overweight and obese. If we combine with the overweight and obese, they have more than majority of them are obese, and also the another ethnicity is represent as Malay, majority that of them. Okay, they show that also 50% of that would age of more than 60 years and above. Okay. So during my observation on how they were driving on the poster of the driving, they show that they show that more 80% of them are at high risk levels. Okay, they were showed 61 plus 23%. They were showed that need investigate and change soon, because they were at the high risk position during the driving. So they will show how they are the current condition, how they are driving character on the poster itself. Okay, and also they show that also during exposure analysis, we are doing the assessments. They show that most of them on the high on the body parts, show that on the necks. Okay, on the neck. Because the maybe the structure or the leveling of the on the focus on driving itself, they will need higher, or maybe the structure of the body itself already decreased, so they will need to increase their necks. And also we see another factor about on the driving factor. Another factor is on the driving factor that show that they're very high. They have significant 86% of them claim that driving factor they will they expose on the risk. Okay. Another is about where we show that on the disease also, most of that are feeling on the muscle injuries. 90% of that, 95.5% have a muscle injuries. So the rest of that, they are not have complain about other factors. Okay. So another one is about lifestyle. Okay, the lifestyle of the elderly people or taxi driver, they will show that most of them choose to be rest at home. Then they are also not as active on the sports, and they will also not involved in housing, cleaning the house during their times with family. They also know to be gardening. Okay, they also no time to they are also not go to spend coffee shop, and also however they significant to show that they have a significant community activity. Okay.
Dr. Irwan, sorry to interrupt you again. Can we jump to our wrap up? Thank you.
And another 1 minute, Dr. Rais.
Thank you.
Sure. This is the important thing to show that most of the taxi driver, their frequent driving per day is more than 6 times per day, and also the total hour driving is show that 92% are more than 8 hours, and they also know to take to rest per week. And also they will show that there are no time to sleep nap during their drivings. Okay, and late driving is show that more equal to more for that. Okay, the driving effect of the taxi driver, most of that shows that majority of that mentioned they are already feeling a carry load to passenger. Okay, the load weight of more than more than 11 kg. Then also they are feeling back pain last 7 days and also last 12 months. So they be sure that most of that are facing on musculoskeletal disorder. Okay. However, okay, the conclusion of the and the recommendation are we ready to be other country? That's my question. What we need to do on the things in the future. So the government should give it more serious and consideration to the order of taxi driver in the health and incentive holistically. Second, from my point of view, the government should also create a law to the that protect the other people or taxi driver among the taxi driver, but their right to a livelihood and well-being. And also young people should play a role by helping their elderly in healthcare and reducing the burden, or not place the burden on this group in the financial context of the housing issue, because there is reason why the older people are still working a taxi driver, because the young people still put the burden to among of them. Okay, the last but not least, if the stakeholder means a manufacturer or designer, or they should emphasize the target user friendly vehicles to design a process to show, so that this group can compete in the face of the increasing challenging economic challenge. Okay, thank you very much. There is my slide today.
Thank you, Dr. Irwan Shah Muhammad Yusof. Now, without delay, ladies and gentlemen, last but not least, before we move to our third presentation, let me briefly introduce our third presenter, Yang Mulia Engineer Tengku Kahar Muzaffar bin Tengku Muhammad Yusof Anwar. He graduated from an engineering background with more than 25 years in multi-skilled experience, focusing on strategy, planning, regulation, consulting, contracting, business development, construction, and maintenance. A professional with acumen in research, project management, and green technologies. Highly exposed to international business environment, especially Middle East, South Asia, East Asia. Presently, the Principal Assistant Secretary in Strategic Planning and International Division in the Ministry of Transport, Malaysia. previously as the head of Macro Policy Unit in the Policy, Planning and Research Division, Land Public Transport Commission of Malaysia. And now I kindly invite Yang Mulia Tengku to present his presentation. Thank you.
Okay, thank you very much, Dr. Abdul Rais. Everybody can hear me, yeah? And Assalamualaikum and a very good morning to all. And thank you to UPM, My Aging, and all the collaborators for this event, UKN, USN, for inviting MOT for the talk. And good morning also to everybody. And the topic for today for MOT is towards age-friendly transportation policy in Malaysia. Basically, what I will do is present and highlight to you what are the present new policies that we have under the National Transport Policy, which has recently been launched in 2019. Okay. Next slide, please. Okay, I think all the earlier speakers have also highlighted these. As a trend, we see that population age 65 years and above is expected to increase to 9% by 2030. And in fact, by 2040, the population will actually be higher than that at about 14.5. So therefore, with this trend, we actually require, as what this theme of this topic also signifies, a rethinking of current transport strategies to ensure transportation is two main factors for the elderly, accessible and also sustainable. Next. Under the National Transport Policy, just to highlight here the vision, which is to develop a sustainable transport sector that accelerates economic growth and supports the well-being of the rakyat in line with an advanced nation status. Essentially, what we want here is that by the year 2030, hopefully by then, also under the Wawasan Bersama strategies, is for us to achieve the developed nation status. And as what we can see in other countries which are developed, how are they doing in terms of transportation? We want to emulate that. So there are things such as focus on public transportation, focus on providing services to the OKU and the elderly. It's one of the things that we want to emulate. And if you take a look at the objectives under the National Transport Policy, the social element includes provide mobility that meets people's needs. And this implies that there needs to be inclusivity and accessibility of transport services. The National Transport Policy has studied 6 main trends of the future. And number one of the trend is a growing and increasingly aging population. This is something that we acknowledge, and we know that this is something that is inevitable for Malaysia, and therefore there are more focus that we need to do to highlight on the importance of providing mobility services and transport needs for the elderly. Next. Okay, these are some of the preceding initiatives that was highlighted or that was focused earlier. Catering to the aging society, you also have a PW, a Person with Disabilities Act 2008. Not to say here that the elderly are OKUs, but if you were to provide all the facilities, all the access for persons with disabilities, that would imply that you also provide transportation facilities for the elderly. And the requirement in terms of infrastructure is that they need to conform to universal design. And we have a Malaysian standard that is have all the details on universal design that can be used. And it is NS 1184 in 2014. So therefore, all the developments in terms of the facilities in the complex, buildings and so forth, needs to adhere this universal design. We also see that this universal design should not be limited to building complexes, but it should also be extended to public transportation services. And next. The Land Public Transport Master Plan 2030, earlier developed by the Land Public Transport Commission, focus on providing universal design for the aging society and also OKUs. So this is one of the targets. The master plan was developed in 2012. So there were also developments along the way, improvements that ensured that developments are what do you call that, have universal design and therefore OKU friendly, hence inclusive for the aging society. We see that there are initiatives taken for not only for public transport, but for all relevant transport nodes, especially airports that were designed to be OKU friendly. I'm showing here the what do you call that, some photos of KLIA that shows you the wheelchair services, buggy, and also areas allocated for reserved for OKUs. Next. Just to highlight also some of the transportation terminals which are very inclusive, which we aim to target for all of the transport terminals in Malaysia. KL Central is very inclusive. Also Terminal Bersepadu Selatan. Essentially all new transport terminals are very much catering to services for the OKUs. Next. We have also ensured that the rail stations and services are also generally OKU friendly. Rapid Rail has highlighted that they put focus on all the rail stations, all the under them to be disabled friendly, LRT, MRT, and by the same token, the trains also provide wheelchair facilities and priority seats to the elderly. Next. Then we go to the bus stops and buses. Universal design are also built for newly constructed bus stops, such as in Putrajaya. There's even an area allocated for people in wheelchair. And in the, what do you call that, Klang Valley especially, and Penang, and the rapid bus, and also other buses, new buses especially, wheelchair facilities with ramps are provided. And also there are priority seats. These are actually all throughout. And therefore we can see that public transportation are what do you call that, are improving so that they will provide more services to the elderly. Next. Okay, we take a look at the National Transport Policy in one of the trusts. There are 5 trusts altogether in National Transport Policy, and Policy Trust 3 looks at enhancing safety, accessibility, and connectivity for seamless journey. There are 2 strategies here which are very relevant. Adopt a safe system approach that advocates safer road users, infrastructure, and vehicles. And strategy number 4 is to strengthen the transport infrastructure to improve accessibility and acceptability. So we can see here that the 2 main focus for the elderly here is about safety and accessibility. I'm on the left of the screen. You can actually see there is an article very recently in March this year that highlights that the National Transport Policy is taking into account elements which are related to the elderly. Next. Okay, we proceed next to the action plans under safety. So we have overall earlier the trust, then we have the strategies. Now actually we take a look at the action plans. The action plans are basically all the main KPIs intended so that we can achieve the goals for the National Transport Policy by 2030. So one of the plans include the Malaysian Road and Safety Plan 2021 until 2030. So although we see here that the good thing is that under the earlier Malaysian Road and Safety Plan 2014 to 2020, the death rate has actually declined by an average of 4.8% annually. So this is actually good news for Malaysia in terms of we have reduced the fatalities for road accidents. And we are now in the midst of developing a new Malaysia Road Safety Plan 2021 to 2030, which will be launched in the 3rd quarter of 2021. And it will cover all aspects of society, including the elderly. We're also looking at, for example, an instance of what happened earlier last year was an elderly driving a car on a reverse flow, and has created accidents, and for the main reason that he has forgotten his touch and go card. And we are now looking into all this and ensure that we want to avoid these things, so that all the elements under the new road and safety plan, we also include all aspects into consideration, including the elderly. Now, the second area is on big data and open data in public transportation. This is a bit ambitious for us to involve ourselves into new IT, IoT, such that we will actually try to, in stages of course, garner real-time data related to what do you call that, especially on public transportation, so that we can actually optimize the supply versus demand. We want to optimize the operations of the public transport together with the users of the mobility, so that we can know where we can actually allocate where the services are. So real-time data is actually very good on this matter. By having real-time data, we also have other information that we can garner. And this will also look at the demographics. For example, we can segregate the data into the elderly, the young, and adults, and so forth. And from there, we can also consider algorithms that can oversee elements of safety that can be looked and improved. For example, if there are areas which are prone to accidents or prone to crimes and so forth, so those can actually be instituted into the system, so that we can actually come up with safety improvements in the infrastructure as part and parcel of the overall ecosystem for the public transportation. Okay, next. Now, we also have action plans under accessibility. So earlier we talked about safety, now we talk about accessibility. Under the short and medium term, there are some some tasks which are, for example, the first one is already happening now and has been undergoing for a few years already, in which MOT conducts regular access audits at transportation nodes, for example, in airports, in LRT stations, in terminals, and so forth, to gauge the level of access for the OKUs and elderly, and from there provide recommendations for infrastructure or service improvements. So we take a look at all the nitty-gritties of the infrastructure over there, whether there are ramps provided for the wheelchair, whether there are able to have access gaps within from the station platform until the train itself, all those kind of things. And we provide recommendations for the operators for them to improve on these things. Now, we also need to look at infrastructure enhancements on the surrounding area. This is something in which we are now undergoing talks with the PBTs, and we do not want to ensure that only the transport terminals are OKU compliant, but we also want to have the surrounding vicinity to be OKU compliant, so that people in wheelchairs can move freely.
Sorry to interrupt. We have 2 minutes more to go. I'm sorry.
Okay, thank you.
Thank you.
All right. So on this regard, for example, we are taking a look here at KTM station in Mid Valley. Upon exiting the KTM station itself, it's difficult for the users in wheelchairs to access the shopping mall itself. So these are the things that we are trying to improve. We also have the Land Public Transport Master Plan, in which the earlier one was in 2012, and MOT is going to come up with a revised version on this, in which we are going to review and provide a more detailed regional plans for each state. So from there, you will actually be seeing more infrastructure being planned for the future, and from there, the nodes will hopefully be more accessible. As per what I will be saying earlier, all new transportation nodes and services will actually be more focused on ensuring that they are OKU friendly and elderly friendly. Next. In the long term, we are also looking for partners and collaborators to look at the VRUs. VRUs are actually vulnerable road users. So they will, this actually highlighted earlier in the earlier focus of My Aging, from what I can see, that this is something that you can also work and collaborate. as such that we can actually take a look at the hotspots of where these people are and establish legal framework on how to improve the infrastructure. Then we also have the framework for shared mobility. Shared mobility is something in which the National Automotive Policy is embarking, the National Automotive Policy 2020, in which we don't actually see people owning cars anymore. So how to go about it? For mobility for urban areas, maybe we can have a strategy so that we can optimize this MAAS concept, and it's very much more amenable for the elderly to use it. We also think that the smart paratransit services will also be introduced in the future that can integrate with public transport, so that this will also be providing more, what do you call that, services which are accessible to the elderly. Next. Then we have high technology. This is, some of them are actually being used now. In fact, in gate control in KLIA, it's already been implemented. They are doing proof of concept at the moment. And we also see that this can actually be enhanced and implemented in other modes of transportation, especially in the rail, that can reduce the hassle of unnecessary movements in order for you to embark the train itself. Then we think that this is something important, that there needs to be onboard devices that can monitor driving behavior. So at some elderly people, they can actually have a microsleep and they can be lethargic and so forth. And this onboard driving monitor can actually provide warnings, provide beeps and other signals to make sure that the driver is staying alert. Then we have the autonomous vehicles. This is very new in Malaysia and other countries. But some testing have been carried out successfully in a lot of countries, such as in USA and also in China. So instead of driving, the elderly can actually use autonomous vehicles that can potentially reduce the risk of accidents. And we actually see there is also actually a test, a proof of concept which has been implemented in Cyberjaya and later in Iskandar region in the future. Next. Okay, this is the last slide. In conclusion, the National Transport Policy is well aware of Malaysia's trending in becoming an aging society in the future. We have ensured that all new developments for transportation would have these requirements into it, especially in terms of the OKUs, and therefore also provide the infrastructure for the elderly. The policy will continue to support and promote higher levels of safety and accessibility to the VRUs. And steps have been taken, but there needs to be a concerted effort from all parties to ensure that Malaysia can be prepared in optimizing and ensuring all its transport ecosystem has to be in line with an advanced nation status as per its vision, so that we can take a look at all the elements which are required to be considered as a developed nation, including providing services for the elderly. For that, I thank you.
Thank you again, Tengku. Thank you to all our invited speakers. It seems that we received quite a number of questions, and we will post all the questions in our chat box, and we kindly request our invited speakers to answer the question in our chat box so that we can have a better discussion there due to our restriction on time. So for that, I thank you everyone for joining us today. So now I'll pass this session back to our chairperson, Associate Professor Dr. Hayati Kadir. Thank you.
Thank you, Dr. Abdul Rais.